Good evening and welcome to this master class. I'm thankful to Karnataka Prosthodontic Society and HKES'S NIJALINGAPPA's Institute of Dental Sciences and Research, Kalaburagi, for giving an opportunity for this master class 2025. And my topic for today's master class is Smile Designing Concepts in Prosthodontics. I'm Dr. Roseline Mishramkar, Professor, Department of Prosthodontics, SDM College of Dental Sciences and Hospital, Dharwad. Smile design is the planning and pre-visualization of the desired end result of an aesthetic dental treatment, targeting a more harmonious state instead of the disharmony. So, according to the rules of the facial, smile, tooth, and gingival harmony, and the individual needs of the patient, paying particular attention to the functional aspects and the feasibility. As you all are budding prosthodontists, you all know that as prosthodontists, we restore and replace the missing tooth and the facial structure. So, giving importance for the function as well as aesthetics. So, wherever the replacement is there, we have to achieve aesthetics as well as the functions. So, the aesthetics is nothing but uh, where we need to achieve required aesthetic results by proper smile designing. So, smile designing is for your complete denture, removable partial denture. It holds good for anything where anterior restorations are there. For example, we even for implants, veneers, removable partial denture, cast partial denture, fixed restorations, fixed partial denture, we need to have the smile designing. So more and more number of patients are seeking dental treatment for want of aesthetics, for a smile makeover. For you to achieve a good aesthetics to a proper smile makeover, we need to understand smile design. So an attractive smile improves the interpersonal relationship. And also we can see that more patients are concerned about aesthetics nowadays. And everybody wants to look young. And smile designing is one process by which a prosthodontist can give a good makeover or a transformation for a patient to have a pleasant and beautiful smile. So, smile design is the planning and pre visualization of the desired outcome of an aesthetics. So, we need to follow certain parameters, certain references for this thing. So, many cultures, aesthetics is different. It is up to a person how aesthetics is very vague in certain culture, but we need to follow certain principles because aesthetics is very personal for some people. For what it looks for one person may not be look beautiful for other. But to achieve maximum aesthetics, there are certain rules and certain parameters or certain aesthetic concepts which we have to follow. That is the goal of smile designing. What is the basic goal of smile designing? Smile designing, when we are achieving aesthetics, we have to develop a peaceful and stable masticatory system where the teeth, tissue, muscle, and skeletal structures and joints all function in harmony. So this is according to Peter Dawson. It is not only aesthetics, doesn't mean only anterior restoration where we just give veneers and fix partial denture or any anterior restorations by just giving changing the shade, color, line, length, and the width. But it should be in harmony with the associated structure. So then only it's a purpose. That should be our goal of smile designing. Along with aesthetics, we should have a functional harmony. So that can be given by following certain rules and also to have an anterior guidance is very important for whenever we are replacing anterior teeth, when we are giving fixed partial dentures, be it implant, veneers, we have to have this anterior guidance so that that is the key uh, role for your success for your restoration. So you need to develop anterior guidance for a stable masticatory system. What are the indications for smile designing? So certain indications are for enamel hyperplasia, restoration of chipped or fractured teeth, closure of diastema. So enamel hypoplasia or fluorosis, whenever there is a patient wants to change the color, change the look. So we can do by smile designing, where mild restoration of fracture anterior teeth, mild diastema is there. So if there is large diastema, it's better to go for orthodontic treatment. If larger fracture of anterior teeth is there, then you have to go for a crown rather than a veneer. So there are certain indications. And also, whenever there is attrition of the teeth where anterior plane is disturbed, we have to increase the length of the anterior teeth to improve the appearance of rotated or malaligned teeth. Agenesis of lateral incisor, for example, there's a peg lateral. There are poor restorations, old restorations where patient wants to improve the appearance, so we need to do smile designing. And components of smile design, we need to understand the different, as I said, you have different parameters, references, and the components. Different authors have given different parameters. If you break down to simplify, we can classify it as facial components for better understanding, facial components, dental components, gingival components. Some of the authors have given as macroaesthetics, microaesthetics, and mini aesthetics. So macroaesthetics, nothing but the facial components. Contraindications are severe crowding, certain type of occlusal problems. Severe crowding is there, better to go for orthodontic treatment. If there are occlusal problems, you have to correct the occlusal problems. First, we need to understand what are the problems in the patient's smile, and then we need to address that. Then poor oral hygiene, high caries index, it's better to not to go for give patient promise of good smile makeover, because they need to understand, we have to motivate the patient regarding their high caries index. So depending on that, we have to choose the dental treatment. Principles of smile designing, as I said, we have different authors have classified as facial components, dental components, gingival components. There are certain parameters. For that, we need to understand certain references. We have to take certain references. So first is the horizontal reference. And in that, we have your interpupillary line, eyebrow line, commissure line. Then we have vertical references. We have horizontal references. We have sagittal references. And we need to have phonetic references. So under these references, we have facial components, that is your facial midline, vertical proportion, facial width, lip fullness, and brackets plane. Under this facial components and the references, we have interpupillary line. So we need to have a reference of both the pupilla. When you draw a line and connecting both the pupils, that is known as interpupillary line, it should be parallel to your incisal line. So that is one of the references. And then we need to understand the contour of the lip, the position, the tonicity of the lip, how the lip is positioned. So these are the facial under the face. So when you see a patient, you should not directly go and we have to analyze the smile. Before analyzing the smile, it should not only just focus on the smile and the teeth. You have to overall consideration of the face. So we need to, that is why even for your digital smile or when you assess the smile, overall facial features has to be taken into consideration. So it's very important for you to consider the facial components or the facial references, wherein the whole face you have to understand. You have to see the type of the face, the pupil, the commissure. There's so many factors which plays an important role. So coming to horizontal references, you have, when you take that is from inner canthus of one eye to the other inner canthus, the distance is that the whole horizontal reference should be 5 width of the eye. So that is 1 width of the eye. That is, you will have the 5 width of the eye should be considered. That is your horizontal reference for any face. Then you have vertical, wherein when you have different reference, that is basically from your eyebrow, from your hairline to the eyebrow. and from eyebrow to the base of the nose, and from the base of the nose to the chin. These are known as the vertical references. And so in this, the lower third of the face, so the from the base of the nose to the chin, this is known as the lower third of the face. Here again, it can be classified into upper one third and lower two third. Upper one third is from the base of the nose to the superior border of the upper lip, and from the superior border of the lower lip to the lower border of the chin. This is known as lower two-third. So the lower two-third of the face determines your vertical dimension. Any change in the vertical dimension has to be assessed by this vertical reference. So you need to understand this vertical as well as the horizontal references. Coming to Ricketts plane. Ricketts plane is, that is, you have to take a photograph and then you have to assess when in the side profile, you have to draw a line from the tip of the nose to tip of the chin. So when you draw a line from the tip of the nose to tip of the chin, that is known as the E line. So normally this can be done, E line can be seen on the photograph side profile of the patient, or on the cephalometric analysis when you draw a line from the tip of the nose to tip of the chin. This is known as Ricketts E line. So normally your upper lip should be 1 to 2 millimeter away from this Ricketts E line, and lower lip should be 2 to 3 millimeters away from the E line. So this is normal for every patient. If there is any discrepancy, that means there is some orthodontic problem. You will have to correct that. So it's very necessary for us to evaluate this Ricketts E line whenever we have to plan for anterior restoration or you are going for any smile correction. So these are the facial components you will have to see. Basically, your interpupillary line, your facial references, that is your vertical reference, horizontal reference, E line, that is known as aesthetic line. Apart from this aesthetic line, we have certain phonetic references you have to ask the patient. So basically, when a patient comes for a smile makeover or a smile design, we have to see the overall face, the teeth, the gingival component, and sagittal reference, vertical, horizontal reference. Along with that, we have to see for the phonetic reference. The phonetic references, which is very important for you to assess, is ask the patient to say some of the words like F, V. When you ask the patient to say F, we can see the height, that is the length of the tooth, that is the cervico-incisal length. So if there is any discrepancy, the patient it doesn't touch the lower lip, when he says F and V, that means the length of the tooth central incisor has to be increased. So you have to have the phonetic references. So before you start with the treatment or planning for a smile design, we need to check for the phonetic references with certain F, V, ask the patient to say yes, and ask the patient to say E. When the patient say E, so that is when there is the lower incisor is in close relation with the lower lip. So it follows the lower lip. So you get a curve. When you draw a line along the incisor, it should be parallel to the upper border of the lower lip. So when you ask the patient to say E, you can assess this smile curve or the smile line. And one more thing is, when you ask the patient to say E, we can see there is maximum extension of the lip, and you can see the amount of the visibility of the teeth, the number of teeth exposed, and so many other things by which we can assess the smile. So we have to have this phonetic references. Once you finish Ricketts E plane, you have to have the phonetic references. Ask the patient to say all these phonetic references like F, V, S, E, and you can also ask the patient to say cheese. That is why we can see the photographers saying, a particular person say cheese whenever they take a photograph, because we get a good smile when you see cheese. When you say cheese, there is maximum extension of your lips, And also the visibility of the teeth, the size of the teeth, the exposure of the teeth can be seen. So these are the some of the phonetic references. Coming to dental composition. So in the dental composition, we have to see for the tooth components and the soft tissue components. Coming to tooth components, in that we have dental midline, incisal length, tooth dimension, zenith point, axial inclination, interdental contact area. Then we have interdental contact area and contact point. Then we have incisal embrasure, cervical embrasure. And according to the sex, personality, age, we have to look in for symmetry, balance. And gingival components, we have gingival health, zenith, then embrasure, and the smile line. Coming to the tooth components, in that first thing is the dental midline. So when we design, first thing is in the facial components, we have seen the interpupillary line and also the facial midline. And then the facial and dental midline should coincide. In most of the patients, there might be discrepancy in the facial and the dental midline. 1 to 3 millimeter deviation is there, it is acceptable. And if beyond 4 millimeter or 5 millimeter of discrepancy is there, it is very difficult to correct. And also this dental midline you take a reference for your philtrum, your nasion, glabella, and the philtrum. So the most ideal reference is your philtrum. When you draw a line from the philtrum gives the accurate position of your dental midline. So that is your dental midline is nothing but the contact between the two central incisors should be parallel to the long axis of the face. And this dental midline should be perpendicular to the incisal plane. That is the line angle that forms the contact between the central should be perpendicular to the incisal plane. And the papilla, that is your cupid's bow of your lip, that is your philtrum, where the papilla is there, that should drop straight down to the your midline to your contact between two central incisors. So that gives your accurate midline, dental midline. Then coming to the incisal length or the incisal edge position, it's very important for you to assess the incisal length. So when you patient smile, sometimes there is minimal display of the teeth. So that means you need to minimal display there. This might be because attrition of the teeth. If there is reverse curve is there is minimal incisal display. If there is short teeth, microdontia, there is minimal incisal of display. So we need to understand why there is minimal incisal display. Then you have normal incisal display, wherein we can see the whole cervicoincisal height of the teeth, and also we can see the number of teeth in display. And then you have excessive gingival display. That might be because of your disharmony between the gingival and the tooth components and tonicity of the lip. So all these factors play an important role in the degree of tooth display. So you need to understand the degree of tooth display in that particular patient, the cause of the tooth excessive display, so that you can correct it. Then, as I said earlier, phonetics play an important role even in the display of the teeth. You have to verify the phonetics by FV sound, so that you can place composite in the incisal edge of the tooth. If the tooth size is very less, the cervicoincisal length of the tooth is less, you place the composite there and assess without bonding agent. You just place there and cure it. And this is for temporary, just to assess, and ask the patient to F and V. When after placing composite, you ask the patient to say F and V. Your central incisor, that is the patient's central incisor, should touch the lower lip. And then patient input, you have to assess, take whenever phonetics is there, and also your vertical dimension has to be assessed. Then different tooth dimensions are there. Tooth dimension, that is, you should have a proportion between the height and the width. So different tooth dimensions can be improved by having certain proportion, follow certain golden proportion. Lombardi is given this golden proportion. Then we have recurrent aesthetic dental proportion was given by Ward. There are different other proportions, golden mean proportion. You have golden ratio. Then we have M proportion. There are different various proportions. So golden proportion is based on apparent width from the frontal view. That is 1.6 for central incisor, followed by lateral is again 0.6. So that is how the gold width varies from central, lateral, and it follows the golden proportion. Then you have recurrent aesthetic proportion given by what? Which says it goes successively. That is, it remains constant. The height and width ratio remains constant as it goes from central incisor to canines. Then we need to understand the zenith points. That is the axial zenith point is again with relation to gingiva, but you have to know the axial inclination of the teeth for central incisor, for lateral and canine. Central and canine, the axial inclination is almost similar. That is more towards little central, towards distal. And for lateral incisor, the inclination is towards more mesial. Then you have interdental contact area and interdental contact point and incisal embrasure. This and interdental contact area is the area between the two central incisor. The ratio should be the interdental contact area should be 50, 40, and 30. That is for both the central incisor, the interdental contact area should be 50. Between central and lateral, it should be 40. And for lateral and canine, it should be 30. That means the contact area between both the central incisors should be 50%. 50s. That is why it is known as 50, 40, 30 ratio. That is interdental contact area should be established. And incisal embrasure is the embrasure, the area between both the central incisor, central and lateral. As it progresses from central lateral, it should be doubly, you should have proper opening of the central embrasure area. That is, otherwise it will look like picket fence in appearance and aesthetics is compromised. So it's always whenever you're giving a fixed partial denture or veneers are placed or implants, any anterior restoration, you have care should be given for proper opening of incisal embrasure. And then you have to, based on the sex, personality, and age, you have to select the form of the tooth, based on the personality. So same, but these principles are basically derived from your complete denture aesthetics. Till now, even for digital dentures, what we are following is basically from the complete denture aesthetics, which was followed from decades. We can say in literature, it is shown that based on the sex, personality, you can characterize the denture, you can characterize the restorations. So we follow the same thing even for the smile designing, wherein for a female patient, it should be more rounded and the size of the tooth should be small, the position of the tooth, and also the line angles should be rounded. And in a personality of the patient, you have to consider a huge personality and the age of the patient. Again, because as age advances, the tonicity of the muscle also decreases, the teeth exposure of the teeth changes, and the character of the teeth, the surface characterization of the teeth, basically the texture of the teeth changes. So all these factors have to be taken into consideration when you're designing a smile. Coming to symmetry and balance, there should be proper symmetry between both the central incisor, not only central incisor, the midline, that is between both the central incisor and lateral incisors of one side of the arch should be mirror image onto the other side. That is, the spatial relationship between these teeth should be proportionate to on the other side. So basically, you have two types of symmetry. You have a static symmetry and dynamic symmetry. So in dentistry, we require a dynamic symmetry, not a static symmetry. Static symmetry looks very awful. It doesn't look good. It is not aesthetic. So there should be a balance between all the proportion of the teeth. If you follow all this, you get a proper balance When we follow the symmetry, we follow the proportion, then you get a proper balance for your smile. So these are about the dental components. So we need to assess the first the facial components. In that you have references. Then we have in that you have vertical component, you have horizontal component, you have then you have phonetic references, and then you have all the dental components. And in the facial components, you can assess the face of the patient, wherein face form also taken into consideration, whether a square form, whether it is a oval, and whether it is all the different square, whether ovoid, these different face form has to be assessed so that you can select the size of the teeth. So all these factors, dental factors, has to be dental components has to be taken into consideration. Once you finish assessing all this, then you have to assess the soft tissue components. The soft tissue components, nothing but your gingival components. So we have to see for the gingival health of the patient, wherein we have to see for the gingival whether it is stipple, whether proper stippling is there, whether the gingival scalloping is there, gingival texture, because whenever there is a gingival inflammation is there, there is stippling is lost, and also gingival recession. You need to correct that by doing different flap surgeries. Gingival health has to be restored. Then see the gingival level. The gingival zenith should match. That is, the gingival zenith is a gingival height of contour, whereas for central incisor, it is at the center, and for both the central gingival zenith should match, followed by lateral, and at lateral should be at lower level. The gingival height of contour, it should be 1.5. It will be at lower level gingival zenith, and both the lateral incisors should have the same zenith. If there is any gingival recession, it has to be surgically corrected. Or if the height of the zenith for the lateral is at lower level, you have to do the gingival correction by crown lengthening or gingivoplasty to be done to match the gingival zenith of the lateral incisor. And the gingival zenith of your central and canine should be equal, and lateral should be at lower level. So, and on one side of the arch, that is your midline, that is away from the midline, that your central, lateral, and canine should be matching with the contralateral side of the gingiva. So these all has to be assessed in the gingival components. Coming to different concepts of smile design, we have analog method and digital smile design. So basically, we have to assess in the patient what are the problems in the smile, whether the height is reduced, whether there is sometimes patient may come only with the fluorosis, or there might be discoloration because of extrinsic color or extrinsic or intrinsic. So we have to assess that. Only the color change in patients want change in color. A simple procedure can be done wherein you need not increase the height or the width of the tooth. Rest of the smile is fine. Only the change of color you have to, it becomes very simple. But at times you have to change. There might be change in you have to change the length of the tooth. That is the height of the tooth. You have to change the width of the tooth. Midline destima is there. So always have a diagnostic wax up. Always begin with the photographs and also video. Take a video and assess the smile. Then take a diagnostic impressions. Then make a diagnostic mock preparation. Then diagnostic wax up is a fundamental. Even if you're doing the digital smile design, before that you need to have a diagnostic mock up. For you to assess that, make a template. After making a template or a stent, then do a temporization. In that, you do the corrections with keeping in mind the length, the width, the embrasures, the exposure of the tooth, the smile line. All this factor has to be assessed. Then you have to, if you go for analog, it is your choice whether you want to go for analog method or a digital method. But even in the digital method, we have to follow all the parameters. And then coming to digital smile design, So before going for proper digital smile design, who should opt for smile design? An individual who wants a younger look. A smile design can improve the appearance. It gives more confidence to patients who want to improve their confidence with their smile, and also who can maintain a good oral hygiene. And some patients even smile a small there is a problem with the lateral incisor, or they want to improve that also, because they want to, their career demands that. So those patients can go for a smile designing. What smile designing can do, it will correct the alignment of the teeth, it can whiten and brighten teeth, makes the front teeth symmetrical in height and width, and it will match the patient's smile with the curve of the lips. It achieves a better gum to teeth ratio. It reduces the risk of tooth decay and gum disease, and also it boosts the patient's confidence. It gives a younger and healthier look to the patient's face. So coming to types, as I said, we can go for analog method or a digital smile designing. Analog, as I said, you all know, you've done, you must have done, or it's just that you need to have a proper uh, photographs. You have to assess the smile, then you need to have a diagnostic cast, then you need to do the diagnostic wax-up. Then coming to digital smile design, we have different softwares, like you have Medit, you have Exocad, you have DSS, you have BSD app by Kaufman, and you have Planmica, you have Cirec. There are different softwares are available. Then coming to procedure for digital smile designing, to have a digital smile designing, to start with the digital smile designing, there are different digital smile designing. So first is, nowadays you have, it's not that you need to have an different exocad software just to motivate the patient. If suppose a patient comes for a smile makeover, if you have an iPhone, in that you can download this IOCLAR smile design app is there. You just download that, take a photograph just in your OPD. If patient comes, you see that patient requires veneer, or patient's anterior restorations has to be changed. There are old restorations and patient needs a makeover. All you have to do is, or patient needs a veneer, of there is smile line is, there is a reverse smile line. All you have to do is take a photograph in your iPhone. Already you should have downloaded this IOCLAS Smile, and then take a photograph. And then when you take a photograph in the patient, suppose you can see in this patient has got a diastema, and you just take a photograph. When you take that photograph, you have in this IOCLAR Smile Design app is there, and that it shows the face form of the patient. That is, you have triangular, oval, or square. You select whichever you want, and then adjust the height and width, and then you can see immediately, you can show to the patient. Suppose you do a smile design, we can correct that. You can show to the patient and motivate the patient for a smile makeover. So this is how it shows. So this is, you have a scale there for you to adjust the height and width. And also you can tell the patient, suppose there is zenith connect. See, the principle is the same, whether you are doing analog method or a digital method, whether you're using IOCLAR app, whether you're using Medit, whether you're using Exocad. First thing is your interpupillary line or your midline, your other facial face form. You have to, and for male, how it should be, for female, how the incisor should be rounded off. All these basic features to be incorporated. So in the software also, you have a set algorithm wherein they have incorporated all this in the software. So when you see in the IvoClar, for example, as I said, in IvoClar software in iPhone, automatically it will connect the interpupillary line, it will assess the midline, and also you have height and width ratio can be scaled up, and your gingival length can be corrected by gingivoplasty. So these are the things which can be corrected. And you can show to the patient immediately so that you can see that before and after smile can immediately you can show to the patient. You can tell the patient that this is how it is going to be. If you go for a smile designing, we can correct the diastema, we can correct the the soft and the hard tissue proportion so that to enhance a we enhance the aesthetic, thereby giving a beautiful smile to the patient. So this is how in IvoClub it can be done. The software, if any of you have, most of you will have phone, you download this IvoClub app wherein you can assess the smile and you can bring out transformation of smile in the patient. So this is how we can use the IvoClar app in your iPhone and show to the patient immediately, and you can motivate the patient. Maybe patient has come for posterior restoration. She doesn't know about the smile which you can create or bring a transformation in the patient's smile, but you can motivate the patient by showing the patient smile before and after immediately. You need not have to make an impression, make a diagnostic cast, assess that, then later on to make a diagnostic wax up, make a putty index, then make a composite. But here, if you have you can download this app, you can show to the patient immediately. You can motivate. Once you show this to the patient immediately will accept. Most of the patient, there is maximum aesthetics is achieved, and you can motivate the patient when they know that final outcome is going to be at least to 90%. Immediately you're showing to the patient this is how the transformation of the smile is going to be, and patient will agree and patient will get motivated. So that was about IvoClar app. Coming to other software, for example, we have a Medit software. Most of the software works in the same principles. So you need to download the Medit software. For this, you need to have different photographs have to be taken. This is about the CPU should have this much of Intel core. It should have a RAM of 16 GB and it should have a graphics. And then we have it should be Windows 8 64-bit should be there. So these are the certain software requirements which you should have. Then coming to digital smile design. For any digital, you need to, for example, Medits, if you're using Medit, you have 3Shapers, you have ExoCAD. For this, we need to have a photograph. So photographs can be captured. You should have a very good photographs for your smile design. One is use a macro lens and first you should have a frontal photograph. So first is data management, acquiring data. Smile design can be performed using 2D images, and supported file formats are JPEG, and Medit usually requires 2 images. You have to have different photographs, a retracted picture, a smile picture. One is frontal photograph. So when you take a photograph, patient should be seated upright, the head should be supported, and patient frontal photograph, when you take each patient should look looking straight, and both the pupils should be visible, and at the same position we should take a retracted. So they should not be changed in the position of your frontal photograph and retracted image. So for your smile design in the software, we should have a retracted mouth image as well. These are the basic things. And then you start your Medit. You have to have downloaded the patient's photograph, the frontal photograph and the retracted photograph is a must. Download that, enter the patient's name and go to smile design. When you go to smile design, first is your interpupillary line. Automatically, it will take the interpupillary line because it is set in the algorithm. See, it's all comes in the different same sequence. Next, you should click that. So first is the interpupillary line. So both pupils get detected here, but then sometimes because it is set algorithm, automatically it detects the pupil. But in some patients, it may not. There might be some changes. It might be at lower level in one pupil. You have to click the mouse and then correct the interpupillary line, and also midline will be detected, halo of the nose, and then you have clearance of the lip. That is, your lip line has to be adjusted. So you first thing to assess your interpupillary line, followed by the midline and the alar line, then your lip line. The curvature of the lip has to be corrected, then your incisor line. So you have to clear the lip line. So you have to adjust the lip line that by clicking the modify lip line. After modify the lip line, you have to correct the incisor line along the edges of the central incisor, lateral, and the canine. You draw the line that has to parallel. So interpupillary line and the incisor line should be parallel. Next is your consultation mode. When you go to consultation mode, as beginning, I have told you about the face form. You have to assess whether it's a triangle, oval, or square. You have to assess the face form. Accordingly, you can choose the your form of the tooth in the software. Automatically, you get a template like this, wherein where according to the face form, you correct that. You choose the template, square, oval, or triangle. Once you get that, you you can scale that, whether to increase or decrease that the size of the tooth, and then gradually you can, according to the lip, you can uh, correct the lip line, the curve of the smile. Once you are corrected that, you can see here how the central, lateral, and the canine is adjusted. Once you finish that, you can see this is how pre and you can show to the patient and motivate the patient in the Medit app, the smile. So in this patient, we can do little bit of gingivoplasty on the lateral incisor because there is a peg lateral. All we need to do is just slide gingivoplasty on both the lateral incisor and then correct the smile. So this is how you can show preview for the patient and motivate. Before you begin with the proper smile designing, actual smile designing in the patient mouth, we can show this by Medit app. You can download the Medit app, you can take the photographs and all the sequence you have to follow. First is the interpupillary line, correct the interpupillary line, the midline, then the smile, modify the smile line, go to the template. In the template, you can choose according to the face form of the patient, whether square, ovoid, and then then you see for the size of the tooth, you can match that. Then you go for texture of the tooth also can be changed. So this is the preview you can show to the patient, the preview how it will look once you in the final smile. So this is about the Medit. Similarly, when this is just to motivate. So the app which I told you about, Ivocla and Medit, is just to motivate, educate the patient, and to show the patient the final makeover, how the patient might look. So the patient will get an idea how the smile is going to transform, and patient can get you know get motivated for the smile design. But when you want to transform the smile, what you have shown to the patient, the same thing which you want to print, or when you have to design it by either by printing or milling, you need to have an exocad software. So we need to have exocad software DSD. For this, again, you need to have first is data acquisition, take along with, like how in Medit we need to have a photograph. That is, you need to have a frontal photograph and the retracted image photograph. Even for exocad, we need to have intraoral photograph, and then we need to have we need to have retracted image, and then we have full face photograph. But along with photographs, when you have to design and you have to mill it or print it, we need to have intraoral impression. Intraoral impression, either you can have an normal analog impression, that is your analog impression. That is either whichever impression method you're following, you make an impression, then you can scan the impression or you pour the cast. If you don't have intraoral scanner with you, you can make an impression, pour the cast, you can scan the, you can, if you have a lab scanner, do the lab scanning of the model of the cast. So you should have a data of either intraoral scanning, that is your digital impression, or you have normal impression to be scanned. If you don't have intraoral scanner, if you you should have a cast. On the that cast has to be scanned with the lab scanner. You send it to the lab, they will scan using a lab scanner, and your data is ready there, and it will be imported. Scan data will be imported into the exocad software. Then you have virtual model creation. So by using exocad modeling tools, you can do that. So here again, how in Medit you have to enter the patient details same way in exocad. Here we have smile creator, exocad smile creators. Digital smile designing can be done using exocad smile creator, wherein you need to have you need to uh, enter patient's data. After entering the patient's data, you have entering the patient's data, we need to download the photographs, and you have to also it will show whether it is a veneer, whether you are going to design veneer, whether it is a full crown. You have to enter that, and then it will show which material you're going to use. Choose the material, whether it is a lithium disilicate, whether it is zirconia, monolithic, whether it is layered, cut back, all this has to be entered there. Once you finish the data entering, go for Smile Creator, download the photograph of the patient. That is full face. You need to have two photographs, as I mentioned. One is full face photograph, and the retracted image should be downloaded. And and then you have IO scan or lab scan. So it will merge automatically when you click the, you start with the Smile Creator. Your photograph will match with the intraoral scan. So your intraoral scan and intraoral retracted image of the photograph, it will align. So you need to align by take 2 points has to be, you have to set 2 points corresponding to the alignment. So you have, it will auto align, and you have to correct that by adjusting the 2 points. When you click there, it will automatically align. That is your photograph image with the IO scanned image. Once you finish that, then you click to the next, then you get the same, like how in Medit, you have interpupillary line, your midline, your smile line, incisal line. Then you get to measure the length and the width, the height and the width. There is a golden proportion set in for male and female. So you have to click that. You will get the, automatically it get adjusted to the golden proportion, or you can manually adjust it. So you get a template, you adjust the midline, then sometimes automatically it will be correct, but sometimes you need to correct it. So you need to align the midline, and then the whole template can be adjusted for the length and the width. So accordingly, and here you can, in 3 dimensions, you can correct the midline. Correct the midline, the position, in the labial position, in the side profile, and the straight profile. Everything can be assessed in all the 3 dimensions. You can adjust the template. So once that is done, you can preview. You can show to the patient. So this is how patient will look. So you can motivate the patient. Once that is done, then model can be printed. It can be saved. After that, model can be printed, and then once the model is printed, you can make a putty index, or you can make a stent of it, stent of the model, and then you can show after the tooth preparation, whether it is a veneer, whether it is a crown. You can after the preparation, you take the template or a stent, use a composite, and show it to the patient how it will look. So this is the virtual try-in And so you fabricate, once you show it to the patient approves of it in the temporary, you can again go back to your exocad. The same thing can be done. Try-in can be done. So some of the cases here where we have done the smile designing is here a patient comes with a uh, makeover for aesthetics. Patient wants to improve the smile. Here we can see patient's height of the tooth is reduced because of attrition, and also patient has fluorosis. So what we had to do is correct the correct the gingival zenith by gingivaloplasty followed by tooth preparation. So here we did a diagnostic wax up, and after diagnostic wax up, what we did is we did a diagnostic wax up or scan. We did a model creation. After model creation, that is printing of the model. Then we got a template of it. After template, that is for your temporization. Then we did with the temporary, what we did, we we temporized in the patient. We did the reverse preparation. We isolated, did the preparation, and then we did the exocad designing, digital smile designing. Before and after we showed to the patient. This is the veneer in the patient's side profile and frontal profile. This is before and after. This was just a veneer preparation wherein digitally we had designed. Same as I said earlier, we can use diagnostic analog method also. Only thing is here, what we did is we used both analog method and digital method. First analog, we did a diagnostic wax up. So it is up to the dentist or a prosthodontist or a practitioner to decide at what level they want to go to. Digital method combination, you can have an analog and the digital combination method. So first the diagnostic mock-up can be done. That can be scanned, it can be printed. If you do, or else you can directly go for digital uh, wax up, and then you can have a mock digital mock-up, and then you can have a um, stent or a putty index, and then you can um, show to the patient, then and then do the correction, and then go for final restorations. This is another case. We can see this a young patient who had come with a fluorosis, and the one side canine was missing. There are multiple problems. Patient had undergone orthodontic treatment. After orthodontic, 2 years and 3 years of orthodontic treatment, this is how still patient had proclination of the teeth. There was gingival mismatch of the gingival zenith. So we had to correct the gingival zenith. You can see here different gingival zenith correction had to be done. And then we had to do to correct the profile. So much of proclination is there after orthodontic treatment also. Patient, so to correct we had to motivate the patient by showing the digital Medit smile. We took in Medit app, we took the photographs. In the Medit, we showed before and after patient. We showed, and patient was happy with the digital smile. And then we carried on with different aesthetic procedure like gingival correction, first endodontic treatment for central and laterals, followed by we made a digital gingival stent. We can see here, you can see here gingival stent was made with digital and then given to the periodontist to correct the gingival zenith. Then we did the tooth preparation. After the tooth preparation, uppers were for crowns, and lower incisor we had gone for veneer preparation. Then digital mock-up, exocad, we did a digital mock-up. We in exocad we designed the smile. This was in exocad we showed to the patient. We can see this is how a smile was shown to the patient. This is exocad smile preview for the patient. This you can see partly here before previous, and this is a new. This is a new smile. This is how the patient exocad smile design was done. Digitally smile design was done. So this was the crown here, and bridge and lower was the veneers. And this is before and after digital smile design in the patient. So this is how patient had come with fluorosis, with the missing, here lateral was missing, and here lower veneers we had to give. So this is how patient's smile was transformed using a digital smile. There's another case where there was a missing, there was no missing teeth, but there was lot of diastema. Patient didn't want ortho treatment. So we did a maxillary diagnostic cast and then phase bow record, transfer on to semi-adjustable articulator. We did a wax mock-up, then exocad intraoral scan, and then digital smile designing was done, different preparation. This is an before and after of the, uh, this is a before and this is after smile designing. There's another case where was a young patient with multiple fracture of anterior. She required a restoration. So we did the analog method we did for this patient, not digital. So I wanted to show different methods. So the first two cases where, 2, 3 cases I showed you the digital, and this was analog method wherein simple patient had this fracture. Patient had to undergo root canal treatment followed by analog method. We did a tooth preparation, and here it was digital transformation. And this was not a digital, but this was analog method. But still, we can create a beautiful smile. It is not whether you're doing a newer method, follow a newer method like exocad, whether you're using medit, whether you're using milled restorations or printed restoration. But irrespective of anything which you're using, any app you're using or a newer method, newer technology you're using, even with analog, we can achieve good aesthetics by following all the principles of smile design. So it is very necessary for us to understand the basic principles of smile design to achieve maximum aesthetics, to get in a uh, to get a good aesthetic makeover and bring in $1 million smile for the patient. So there's another case here. It was a very challenging case wherein there was a cleft lip. Patient had undergone ortho treatment and there is a missing lateral incisor. So we had to take a photograph. We took a photograph, we made a diagnostic cast. After the diagnostic cast, space analysis was done. After space analysis, we did a routine procedure. We did a phase bow transfer, the mounting of the diagnostic cast, and then preparation of the teeth. Since there was lateral was missing and there was no canine, we transformed the premolar to canine. Can you see there is a missing, there is canine is missing here, and we used digital method, we used lithium disilicate restoration for this patient. This is how the smile was given to transformed in this patient. So it is not the technology which you are using and bringing out, as I said earlier, it is not the technology which will transform the smile. Yes, to some extent you can use if you have, but even with the analog method, we can achieve good aesthetic and a good smile makeover for the patient with by following certain principle. So we can future perspective is we have different technology can use. We can use face scan instead of we can use intraoral scanner can be synced with facial scan and newer facial scan, robotic in smile designing. So many things are there wherein we can transform the smile. So I would request all the students and delegates, participants to understand the smile design, to understand the components of the smile design, to assess the smile of the patient before you start with the smile designing. You have to understand what is the problem in the patient's smile, how to bring out the uh, maximum aesthetic in the patient by analyzing the smile to understand the height, the width, the proportion, the balance, the symmetry, the gingival, to get the balance between the white and the pink aesthetic by correcting the uh, tooth proportion, the gingival zenith. So all the principles has to be followed to get in the maximum aesthetic smile makeover for that particular patient. Thank you for your patient listening. I thank the organizer for giving me opportunity for uh, giving for giving me opportunity for this master class. Thank you. Thank you.